My father-in-law, from the age of 17, was a smoker. He was 17.
17?
Yes, he was smoking up to the age of 58. 15 cigarettes a day. For 40 years he smoked.
Yeah.
Okay, 15 cigarettes a day. He used to get reflux. He used to take medication for countering the reflux. They realized it was an ulcer. The doctor said it's a tumor. They cut 50% of the stomach. It had touched 2 lymph nodes in the biopsy, of course. He went for 6. He got chemos done in 6 sessions. He went for 25 days of radiation. Subsequently, every 6 months he got PET scans done. After 5 years, he was declared clinically normal. He was traveling, driving, everything. But for those 5 years, from 2004 and 9, he had changed his diet. No smoking. He never drank a lot before. He continued drinking very little, maybe 4 drinks a month. Not much. But he started walking every day. He started eating healthier, more fruits, more salad. He was taking a tablespoon of natural turmeric every day. He was doing that. I think somewhere in 2009 he slipped. He wasn't disciplined. 2007 his prostate was enlarged. It was removed successfully. In 3 days he was traveling. He ate prostate. It was positive.
Also removed.
Removed. Biopsy was positive. 2011 November, he felt a lot of pain. They thought there were stones in the gallbladder. He got admitted. Fortunately for him, the doctor who did the surgery of the CA stomach did the gallbladder surgery. They could not do it laparoscopically. The gallbladder got ruptured. The biopsy was negative. It took him 3 weeks to recover. He recovered only by December end of last year. He traveled outside for 1 month, middle of February. Middle of March he came back. 15th of March onward he started getting fever. The fever continued and it became higher and higher. The general physician said to do a blood test. LFT counts were very high. The liver function test counts were very high. They did an MRCP. It showed a cyst in the bile duct. The doctor said it's serious. They did an ERCP on April 3rd this month. They put a metal stent, a very thin one, which was very difficult because the anatomy had changed, because half the stomach is not there, gallbladder is not there. But they were successful in putting the stent. They could not do a regular biopsy because the cyst was adjoining blood vessels. They said if they cut, he will bleed. So they did an FNAC, a needle biopsy. It showed it's malignant. They were not sure. They checked the slides of 2004 of the block, and they compared the slides of the FNAC. The cancer cells are a little different, so they feel that it's a bile duct cancer. It is not the recurrence of stomach. That's the answer we have now.
It may be possible later on that there will be a blockage, so you just have to
because the cyst will grow.
First thing, it could be a fine tube, and I think they may have to change this.
After 6 months, 8 months. Yes.
Oh, they say it's 6 months. Okay,
6 to 8 months.
There was this man who also had, he had a stent done in the hospital. Out of the hospital, he came here, asked for help. So every 6 months, he came back to do a change of the tube. The latest was he was extremely happy because the doctor who looked through, he said, something amazing happened. Seems to be improving. You do nothing, you just put a stent, and then why are you improving? You know? So he said, because I took the help. His case, is he taking any medication?
Not right now, but
what is the doctor trying to do?
The doctor has said surgery. He's inoperable. He cannot have surgery. The cyst is in the porta region of the bile duct. The cyst size is 3 into 3 into 3.7 centimeters. The cyst 3 into 3 to 3.7 centimeters. Adjoining blood vessels, inoperable. They say chemotherapy success rate is only 20%.
Chemotherapy 20% success.
Yes. We are looking at going for radiation, the new one, CyberKnife.
Okay.
Now either CyberKnife
Yeah.
or Rapid Arc. CyberKnife or Rapid Arc. That's a new Rapid Arc. ARCH.
Rapid
Arc.
Arc.
Arc. That's the new one. Yeah. Rapid Arc. Now, CyberKnife, they say, is very targeted only for 3 days. It automatically corrects if the body moves while breathing. And there's one institute in India, there are only 2 or 3. But the fear is, because there's a stricture already in the bile duct,
Yes.
therefore they put the stent. Putting heat might create more strictures.
Yeah.
We don't know.
Yeah.
Now the doctor said, I want to see him on Thursday
Yeah.
to see if he can even do, he wants to do a technical test on it. He wants to do an MRI and PET again to see if he's able to do that. But he feels he's been doing it, he's been doing this on patients in the past who have a stent in the bile duct and even gives CyberKnife radiation.
Yeah.
So I have a question to ask you.
Yeah.
Should he go for it or not?
If you think that you want to take the herb, well, you have to decide. You give the herb 3 months,
Okay.
and within a month, you will see whether you improve.
Okay.
And if you think that you have improved, then you will not want to do that.
Okay.
But if you think that it is not giving you any improvement, then you go for broke, so to say, whack and see. But to me, technology will not cure cancer.
Okay.
I have seen enough.
Yes.
Technology does not cure cancer. It's impressive, but it cannot work. If it does, then America would be the best. That is how I feel it.
Correct.
The same thing they do with brain CyberKnife for the brain tumor.
Yes.
It's a disaster. They cut it off. 3 more babies come out after that. 4 more babies come out after that. It's happened all the time. So I am skeptical about technology as such.
Okay.
Knowing the risk involved.
Yes.
They may say, they may claim anything, but there you are. If you don't target it properly, you may cut something else.
Yes. So doctors have told us, 3 different doctors have told us.
Yeah.
The GI who put the stent in says, I gave him a few months.
Yeah. What do you mean by I give a few months?
He says max 3 to 7 months.
3 to 7 months. And
Maximum a year.
What happened?
They will say he will not survive beyond this.
Oh, can't survive longer. Oh, can't survive. Don't remember. That's the worst first doctor.
The onco doctor says if it's the bile duct cancer, it can be a maximum of 30 months of survival.
How much?
30.
30 months.
Yeah, 30 months. If I'm correct, he said 30 months. Yes.
All right.
And he also said if the tumor grows and blocks the stent, it's history in any case. Then he won't survive very long.
He won't
the
survive
tumor
very long.
grows, yes. Because even replacing a metal stent is not easy as opposed to a plastic stent.
Yes, correct.
And
Now, this is a plastic or is
metal,
it
but a very thin one.
Oh,
a very thin metal
right,
stent.
yeah. Normally they put a plastic
In
stent.
his case, they could not.
So you could not do it. Oh, I see. All right.
Because of the stomach half removed and gallbladder removed, it was a very difficult ERCP.
Yeah.
So he put a very thin metal stent. It took him over an hour, which takes 15 minutes otherwise, he says.
And then what's the third doctor saying?
The third doctor says, and the reason they all are saying the same thing, because it's inoperable. The cyst cannot be removed. It's bad news to begin with. Cancers of the bile duct region are typically aggressive by nature. So the other person says also a year at most.
Okay, now we are looking at a person who is medically, you have 1 year. No matter what you do.
Right.
Looking at a history like this, I'm amazed that he can survive that long.
Yes, it's amazing.
Yeah, amazing.
Yeah.